The mission of the Retina Institute is really quite simple. We're there to give you the best, the most advanced retinal care available in the context of your full body disorders as well as your retinal disorders, such that by linking it all together, there is no base unchecked.
Call 504-455-0500 in Metairie and the West Bank or 985-871-9920 on the North Shore to schedule your comprehensive eye evaluation.
I had no vision problems, no blurriness of vision, and no anything, no floaters whatsoever. And then one night it just started to happen and I couldn't see out my left eye.
I was at work one day and I just felt this real funny feeling in my eye, like something was just in there and I couldn't see it. And I kept thinking it was my hair, so I kept pushing my hair on the side. Well, later I found out that it was a floater. And then the next day when I got up, I just couldn't see out of that eye at all. It was just totally black.
When I first noticed it, I had a problem was when we were driving on the highway and the trucks in front of me looked like they were kind of slanted sideways. That's how I first knew that I had a problem.
All of a sudden one day, I noticed that when I was just reading regular script that it was somewhat squiggly. And that was the real telltale sign that something was wrong.
A retinal specialist specializes in the part of the eye that involves the retina and the vitreous. The retina in particular is the wallpaper inside the eye. It's actually brain tissue, so it has a special place in terms of its significance of disease, the gravity of disease, and a special relationship with full body disorders such as high blood pressure and many others. So in diagnosing retinal disease, we often rely on a knowledge of what is going on in the full body as far as those list of diseases that the patient may be dealing with, in figuring out what is going on in the retina, and in treating the retina, we often rely on better treatment or a change in treatment of the full body disease in order to benefit the health of the retina. It is critical for patients with diabetes specifically, but also with other full body disorders, including autoimmune disease like rheumatoid arthritis, lupus, and even simpler disorders like high blood pressure, to be getting regular eye exams. The reason is there can be significant damage in the retina. If you take diabetes, for instance, it is a disorder which at its worst is literally not compatible with life. It is a metabolic disorder where your cells are literally not as well capable of using the food of life, which is sugars in the bloodstream. At its worst, not compatible with life. Now, even though a person may not have the most severe full body level of disease and diabetes, they are still, if the disease is not fully controlled, going to be suffering a slow simmer, if you will, of disease in the retina and in other organs that mimic the retina. So eye exams in particular, and at the Retina Institute we specialize in that, will be able to tell through diagnosis on exam and specialized testing such as scanning laser tests as well as angiography, the level of disease in the retina, and be able to put that together so that we can tell how much the diabetes is affecting the health of the retina. We can take measures at that point to reverse that disease, or at the very least to slow it down, in concert, of course, and this is what we really focus on, with controlling the full body disease.
In the field that I work in doing carpentry, it's important to be at least able to read your measuring tape, which goes down to a 1/16 of an inch. So in a 1/16 of an inch over, if you multiply it several times, you could end up with something that's inches too long or a few inches too short. So it's pretty important to be able to see down to a 1/16 of an inch, which is something I couldn't do before I came to see Dr. Ebrahim.
Macular degeneration is a disease that affects the retina in a very particular place, and it is the most important real estate in the retina, if you will. It's the part of the retina that is responsible for the finest central vision. That's what really makes it a devastating disease. It tends to hit older people, and the tragedy of it is that after working a full life, when hitting retirement, many of these patients are debilitated then by this central vision loss. The way the disease works is that it is a simple degeneration in most people of the retina and the tissues beneath it at the center. That's called dry macular degeneration. But a certain percentage, a smaller percentage, about 10%, will progress to wet macular degeneration, which is a more severe type, and even though it's only 10% of the disease, is responsible for about 90% of the vision loss because it is more aggressive. We've actually gotten very good at treating the wet macular degeneration with medicines that basically are able to help the disease regress. So the transition in wet macular degeneration is involving a growth of new blood vessels under the retina in this central location, unfortunately, which then are leaking and bleeding and causing significant scarring, sometimes very quickly. Again, that links back to the need to diagnose retinal disease quickly, which cannot be done unless the patient comes in. The things the patient wants to look for at home is a change in the central vision in either eye, so you want to check the eyes separately, such that straight lines are wavy, or if there is anything missing in the central field of vision, there is something called an Amsler grid, which can be found on our website, that you can download and look at with one eye at a time at about 14 inches, which is very useful in early diagnosis. The most sensitive test for macular degeneration is in fact an angiogram in the office, which helps us to tell the difference between dry and wet, and then initiate proper treatment. Proper treatment in macular degeneration and even wet macular degeneration has given people a 90% chance of either keeping or gaining vision. That is a phenomenal statistic, something that was not available even less than 10 years ago. So the treatment options for macular degeneration, when the dry form is present, which is the majority, is mostly preventative options, such as a certain type of supplements, generally considered to be 3 that I use, that slow retinal degeneration. That field is always changing and improving, and as it does so, if the patient is plugged in, they can benefit from more preventative care. There are in the pipeline treatments for dry macular degeneration that may literally be able to stop the degeneration and even reverse it. That is not currently available, but I believe will be available quite soon. For wet macular degeneration, the treatment is already much more robust in the sense that we can deliver treatments which frequently are given monthly or even less frequently. That's been very effective. It's very satisfying to deliver that treatment because patients really do benefit on a large scale. Like we said, 90% of people can expect to either maintain vision or even improve vision.
Every now and then I'll run across someone who says, "Oh, my grandmother has the same thing," and I'll say, "Does she go to somebody?" Because there's stuff you can do. There are procedures that are not that invasive, that will restore your eyes. Maybe not totally, but tremendously. They'll put you back on your feet. They'll give you your life back.
So we've come a long way in macular degeneration. We have a lot to offer. The biggest obstacle now tends to be patients not getting into treatment early enough.
If you've been diagnosed with diabetes or macular degeneration, you should protect your sight with regularly scheduled eye exams. The Retina Institute provides comprehensive eye evaluations that could help save your precious sight. With convenient locations in Metairie, the North Shore, and the West Bank, it's easy to schedule an appointment. Call 504-455-0500 in Metairie in the West Bank or 985-871-9920 on the North Shore. The Retina Institute, when you need leading-edge retinal eye care.
A number of disorders that affect the retina are working like diabetes in the sense that they really put a large stress on blood vessels, eventually hurt the lining of the interior of very fine blood vessels that perfuse the retina and other organs in the body. When these blood vessels break down, you're literally witnessing a patient outliving their blood vessels. It's a very scary thing to see. And you're watching the retina, which again is brain tissue in the eye, lose blood flow and begin to slowly drift off and not function. That is a permanent and in many cases irreversible disorder when not caught early. So for diabetes in particular, we rely on the A1C very, very much. And we're surprised sometimes to find patients that have had diabetes as long as 30 years that don't know what the A1C is or don't know even what the term is. So I'll explain what that is. The A1C is a blood test, and it's used on just about every diabetic to follow the control of the disorder. It tells you in that one number about a 3-month average of the control of the blood sugar. So unlike an individual pinprick blood test, which tells you the blood sugar at that moment in time. An A1C will tell you the 3-month average. Therefore, it will take into account all peaks and troughs, and it's a much more reliable number when you want to follow the overall control of the disorder. That's critical to us because we know that if you keep that A1C at a reasonable level, typically at 7 or below, that the patient will have a reasonable expectation of not worsening in terms of retinal eye disease.
Actually, I was having problems with my retina for a few years, but never knew it. And so I didn't know it until I actually had some bleeding behind my left eye.
There is great success. This has been studied for decades now. And there are even long-term studies showing how patients that have had diabetes for 30 years and received treatment 30 or even 40 years ago have progressed now, and they've done great. The treatments have reversed the trend of vision loss and maintained the vision that the patient had. That's what's so satisfying about it. Again, there can be a great trend among some diabetics towards noncompliance. But I'd like to tell my patients the burden is not just on you to watch your diet, although that is a great burden and it is absolutely critical if you're going to do well. But there are medicines available which can help you control your sugars and your blood pressure, and that's all essential so that you do not drift off into unnecessary retinal disease.
I have uncontrolled diabetes, which I'm trying desperately to get under control. So he always suggests, have you seen your endocrinologist, and he'll also have high blood pressure. He makes sure that I'm seeing my primary care doctor. He's just very caring. You feel like you're not just going to a doctor, it's just someone who cares about you and what your outcome is.
Any even subtle vision loss in a diabetic should be taken very seriously. You can, as in macular degeneration, use the Amsler grid. However, you should not rely on visual changes to get in and see your doctor. You have to have the regular exams. It is absolutely possible to have the most severe form of diabetic retinopathy and to still have an almost perfect central vision. We do see that, and these people are, in essence, hanging by a thread with their central vision, although the entire peripheral retina is basically dead, and there are even retinal detachments present that the patient has simply overlooked because their central vision is so good. If you have diabetes and you are between eye exams and you notice even the slightest bit of visual change, you must be seen. You can't just wait to see if it gets better, because there's some fast-moving disease in diabetes, and that is something that is typically able to be stopped should you come in quickly.
I've been fortunate that, when he does the laser surgery, I'm not losing any of my vision. All that's remaining intact, thanks to him being able to do the surgery. And the most important thing now is to get my diabetes under control.
Dr. Ebrahim is he's very conservative, he's very caring and professional. He looks at all aspects of your life, your activity, your health, to see how it's going to affect your eye, and he has basically kept an eye on things. He's been there if I've ever had any problems, and he is conservative in the fact that he doesn't want to do any treatments unless they're absolutely necessary.
I believe hypertensive retinopathy is one of the most overlooked subtypes of retinal disease.